Every month, millions of people experience the exact same deep, aching cramps in their lower abdomen. The symptoms frequently extend beyond the abdomen, involving radiating lower back pain, heavy soreness in the thighs, waves of nausea, and intense fatigue. Historically, cultural narratives have often minimized these symptoms, treating period pain like a minor inconvenience or a generic tummy ache. Science shows that menstrual pain is the measurable physical result of a specific biological process happening inside the pelvis. The process centers on the uterus, a hollow, muscular organ that supports pregnancy. This cross-section shows the endometrium, the uterus's inner lining. Each month, this tissue thickens with blood vessels to prepare for pregnancy. If fertilization doesn't occur, a graph shows hormone levels plummeting. Without these hormones, the body breaks down the lining, expelling it as menstrual blood. The pain felt during a period is the direct byproduct of this internal demolition and removal. This removal process is triggered by the release of hormone-like chemicals called prostaglandins. Prostaglandins act as messengers that command the muscular walls of the uterus to forcefully contract. A useful way to visualize this is to imagine a soaking wet sponge. To remove the trapped fluid, you must squeeze the sponge tightly. The uterus performs this exact mechanical motion. It flexes and squeezes its muscular walls to push out the detached lining and menstrual blood. While this contraction is necessary for the cycle to continue, the mechanical force required to clear the uterus creates the conditions for severe pain. The true source of the pain lies in the extreme intensity of this squeeze. In this close-up of the uterine wall, we can see the fierce muscular contractions physically pinch down on the blood vessels woven throughout the tissue. This compression drastically reduces the supply of fresh oxygen flowing into the uterine muscle tissue. This is the same agonizing mechanism at work during a heavy workout, when an overexerted muscle lacks enough oxygen and begins to cramp. The intensity of the pain scales with the chemicals. Higher prostaglandin levels trigger a tighter squeeze, cutting off more oxygen and leading to significantly more pain. Period cramps are essentially the physical sensation of the uterine muscle temporarily suffocating itself of oxygen. Doctors call this baseline cycle of chemicals and contractions primary dysmenorrhea. Driven by the body's natural chemistry, this type of pain typically begins during the teenage years. While the cause is chemical, variables like high stress, anxiety, or a naturally low pain tolerance can act as amplifiers, making the contractions feel much more intense. Primary dysmenorrhea can be highly uncomfortable, but it indicates that the reproductive system's chemical messaging is functioning as designed. The situation changes with secondary dysmenorrhea, a condition where pain is driven by an underlying disease rather than a natural chemical byproduct. Red flags for this condition include exceptionally severe pain, suddenly worsens with age, lasts longer than the period itself, or occurs outside the monthly cycle. Structural issues are often the cause. As shown here, uterine fibroids can grow within the muscle wall, disrupting the anatomy. Other common causes include endometriosis or pelvic infections. These conditions require medical diagnosis and should not be endured in silence. By understanding the exact mechanical reality of a cramp, you can distinguish between the normal function of a healthy body and the warning signs that it is time to seek professional help.